After any medical procedure, there are those small, everyday routines you look forward to getting back to. It could be enjoying your favorite meal, taking a walk, or simply stepping into a refreshing shower. When you are recovering from diverticulitis surgery, knowing when you can comfortably and safely resume these activities is a key part of your healing journey. Regarding showering after diverticulitis incision care, the direct answer is that you can often shower within 24 to 48 hours after surgery. However, this timeline is not set in stone, and it is critically dependent on the type of surgery you had and your individual surgeon's specific instructions for your wound care. The reason for this careful timing centers on protecting your incision and promoting optimal healing. Your surgical incision is a gateway that needs to close and seal properly. Early exposure to water, especially standing water like in a bath, can introduce bacteria, increasing the risk of infection. Furthermore, constant moisture can lead to maceration, which is the softening and breakdown of the skin around the wound, potentially delaying healing. The type of surgery also plays a big role. A minimally invasive laparoscopic procedure with small incisions might allow for showering sooner than an open surgery with a larger incision, which often requires more extensive initial dressing care. Once your doctor gives you the green light to shower, there are important steps to follow for safe incision care. First, make sure you have clear instructions on whether to remove or keep any dressings during the shower. If the incision is exposed, use a mild, unscented soap and gently let the water run over the area. Do not scrub or rub the incision directly. When you are finished, pat the area dry very carefully with a clean, soft towel. Avoid rubbing, as this can irritate the healing tissue. Remember to completely avoid baths, hot tubs, swimming pools, or any prolonged submersion of the incision, as this significantly increases infection risk. For an even smoother experience, consider a few insider tips. If you have a handheld shower head, it can be incredibly useful for directing water away from the incision or gently rinsing it without strong pressure. If your incision is in a hard-to-reach spot, or if you feel unsteady, asking a family member or friend to assist you can provide both safety and peace of mind. Also, if your dressing accidentally gets wet, do not panic. Simply remove the wet dressing, gently pat the area dry, and apply a fresh, clean dressing as instructed by your care team. Always have extra supplies on hand. Ultimately, the goal is to support your body's natural healing process while maintaining good hygiene. By understanding the reasons behind your doctor's recommendations and carefully following their wound care instructions, you are taking proactive steps toward a smooth and healthy recovery from your diverticulitis surgery. Your well-being is the top priority, and adhering to these guidelines helps ensure your incision heals cleanly and effectively, getting you back to your full strength sooner.